Jesus yalla me wade me de manali da baby to follow nyanya sora we Africa baby say so we me know me be nyanya Mama Africa oh Mama Africa Mama Africa come on stand up and dance it come on Africa, maybe say no way. You know me, baby. Let's go. Come on, let's celebrate. Mama Africa. Oh, Mama Africa. Mama Africa. Come on, let me see you do it. Come on. The show, come on. The show, The show, the show, the show. The show, come on, what? The show, The show, the show, the show.
No matter where you live or who you are, each of us can help break the chains of COVID-19 transmission. Here's what you can do to protect yourself and others. Cover your cough and sneeze. Clean your hands frequently and thoroughly, especially before and after putting on a mask and going outside or coming home. Avoid crowded places and mass gatherings. Avoid touching surfaces in public as they might be contaminated by someone with the virus. Socialise at a distance. Stay at least 1 metre away from others as much as you can and wear a mask if you can't.
Hello world, welcome to African Let's Talk. My name is Collins Kofi Opon. You can call me Mr. Beyond. If you have joined this conversation, please do me a favor. Keep sharing the video, invite your friends. Let's do the watch party because indeed, this conversation is one conversation that we all deserve to listen to. So like I said, welcome once again to Africa Let's Talk. My name is Collins Kofi Opon. Indeed, we live in difficult and terribly uncertain times. The scourge of the COVID-19 and its profound impact continues to hurt our communities. This, coupled with difficult life changes, loss of jobs in most instances, and the fear of the unknown, have actually left many people in the African community especially sick with worry. As we continue to contend with this reality, our wellness and health cannot be compromised. Today, we are talking about improving wellness as the COVID-19 cases keep rising. With me for this discussion is Dr. Sam Asante Boabin. He is a medical doctor with a leading health institution in the Twin Cities. In the course of the program, we'll be joined by an individual in the community who actually contracted the coronavirus, and he has since recovered. He will share his story and experience with us. This program is actually supported by the Hennepin County Community Health Improvement Partnership. At this moment, ladies and gentlemen, wherever you may be, please help me welcome for this discussion today, Dr. Sam Asante Boabin. Hello, sir. Good to see you.
Good to see you, Collins. And thank you for having me today. It's always a pleasure to be here. I think we had one program a few months ago, and I'm so thrilled and happy to join you today.
Absolutely. And I'm happy indeed to always have you as a resource person. Like you mentioned, at that time, the situation with COVID was very different. Even we were saying that, oh my goodness, the African community was spared. Now it's no more the situation. The situation has changed. So the first thing I would like you to do is for actually educate us about the interesting trend. Like I said, the situation has changed since the last conversation for at least the past couple of months with regards to the COVID-19.
Right. Again, thank you for having me, and greetings out there to anyone who is watching this program live on Facebook or here. So I know that the last time we met, that was when social distancing, the term social distancing was beginning. Now,
Yes.
I believe that is a household name. Since then, a lot of things have happened, and I don't want to bore your audience with all the statistics. We all know what's happening in the States and elsewhere. Almost every country has been affected by this coronavirus pandemic. Currently in the United States, the trend, some places are really seeing an uptick in the number of cases. So far, it looks like death rates have gone down or plateaued at best. I'm not seeing so many deaths as we used to in somewhere in April, May, thereabout. So those are good trends. The country is not affected the same way. I mean, continental United States is not affected the same way, but that is by no means to minimizing the impact of this coronavirus. The other trends that have come up is that so science believes that there have been some changes in the virus different from the one that was found in Wuhan, China. Since then, we believe that there have been about 4 mutations. The good thing is that the mutations are not major. The changes are not major. And why do I bring this up? I bring it up because it's good for vaccine development. Because one of the things about viruses is that sometimes they keep changing their strategies and their ways of living. And so if you get the vaccine against the virus today, tomorrow it changes its skin, you go back to the drawing table because what you did won't be effective against it.
Wow.
We're in good times because, as I said, the changes that have taken place so far have not been that great to affect, vaccine development. So that transitions me into vaccines. And so there are a number of trials that are going on right now. In fact, last count, there are about 165 vaccine trials at different stages all over the world. And in different stages or phases of development. Currently, there are about 27 of them that have gotten to the human trial phase. So, again, vaccine development starts from planning and all that stuff. Then at a point in time, we have to transition to the human trials because ultimately it's meant for human beings, right? So 27 of them are actually in that stage. And a few of them are actually in the 3rd phase. So just a brief definition of the phases of vaccine development. Phase 1 is actually a small trial of usually less than 100 healthy adults who are the first to get the vaccine as it comes out. Then, depending on the response, goes to phase 2, a few, hundreds to several hundred people. And then phase 3 is actually the mega phase where thousands of people are given this vaccine, and they target it to the, sort of the target group. What I mean is that if you develop a vaccine for children, you don't trial them in adults, and vice versa. So, phase 3 means that everyone basically that lives on Earth will be a candidate, and a few of the vaccine development are actually in the phase 3, which is really good news for us if everything proceeds the way this is astronomical speed. So I'm excited about that. So
wow, that's amazing. I mean, that's some good news out there with regards to how the vaccine is, and of course the trend since we have that conversation has taken place. Thanks so much for actually taking us through that phases of the vaccine and its development. Once again, this is Africa Let's Talk. My name is Collins Kofi Opo. You can call me Mr. Beyond. Like I said, today we are talking about improving wellness as COVID-19 cases keep rising. And with me in on this conversation is Dr. Sam Asante Boabin. So please, if you join the conversation, you have any questions for Dr. Sam, and there's something you're not very sure about, please, you are more than welcome to leave your comments or your feedback in the comment box, and I would definitely at the right time ask the questions to him. Like I mentioned earlier, at some point in this conversation, I'm going to bring into the discussion a gentleman who actually contracted the COVID-19. He's an African in the community. He contracted the COVID-19. He has since recovered, and he has actually decided to share his experience and his story with us. So please stay tuned, share the video, get others to see it as we get into this conversation. Doc, the next thing I want to talk about is about the social, economic, and of course the health impact of the virus and how much it has affected. We want to know how much of that impact has affected the well-being or the wellness of people.
Yeah, thank you. I think it's a very great question. I believe that this whole COVID-19 pandemic has had some far-reaching consequences. And I'm not sure we are at the end yet. That we haven't seen the full effect of this COVID-19.
Wow.
So I mean, because when we met up 4 months ago, it basically had no impact.
True.
Fast forward, and almost everything came to a standstill, and so it has affected different areas of our lives. I'll start with even when you take the church, for instance. Most of us, most Africans, are Christians by faith. This is not to say the other faiths don't matter, but since the end of March or something, like, we have not been able to meet.
Yeah,
right? That affected the faith of many. We don't know the impact that is having on these. Health. The COVID-19 actually brought to the fore some of the healthcare disparities in the society that we live. It's very unfortunate, because you would think that this is the United States of America and everyone who lives here must be able to access healthcare and get the best kind of care. But that's not the case, as COVID has actually unraveled that this has had a worse impact on minorities and low-income groups than other groups. So when you look at death and its impact, it's been disproportionately. It's affected minority groups. When you look at education, our children have been at home doing classes on Zoom. I am not sure whether you have a child or not, but I'm not sure.
It's a similar situation.
Right, because they watch videos, and they go home, and we're done for class. And that takes less than 30 minutes. And there were times that I was on, and it was just fun. Hey, what did you do? Where did you sleep? And all that stuff. And then in 30 minutes time, you have to do some, and then it's done. I'm not sure that's how children are made to learn. Children learn in a certain environment and with a certain structure. So that has also been affected. The other thing is the psychology of the people. I mean, concerns about depression, anxiety. People are at home. We are a community that is very interactive. We are a community that loves to have parties. We go to places. We do things together as a community. We have different groups in this state, or for that matter, I believe most of the states, that meet to socialize. All things have been curtailed, and people are now stuck at home. And there's depression. There are stories about suicide rates actually going up and things like that.
Yeah.
The next thing I'll talk about, which is probably the elephant, is the economic impact of all this, especially in the minority community.
Right.
income, loss of jobs, and things like that. The risk to us, not everyone drives. People ride the public bus transport system. They've been curtailed, and the risk of riding some of those things are there. People are afraid to even hop on buses and things like that. So you realize that there's, people who work in the service industry, people who work in, grocery stores, people who drive cabs, Uber services, all these things have almost completely shut down. I mean, so it's such a difficult time for everyone. So one way or the other, we've all been impacted by this thing. We never thought that what I do affected your job, and what you do affect somebody else's job, and this. But this should open our eyes that, hey, we are intermingled, and we are just
indeed.
We are just different parts of the same body. So I think the impact is really
right
too.
Okay. Yes. All right. Thank you so very much, Dr. Sam, for the explanation as to how impactful this has been on the wellness and, of course, the well-being of the people, especially the people in the African community. Once again, this is African Let's Talk. My name is Collins Kofi Oppong. Today, we're talking about improving wellness as COVID-19 cases keep rising. If you have any experience you want to share with us, you are more than welcome to do so, even as we delve into this conversation. Doc, indeed, when we talked about how, the African, we were really intertwined, like very a connected community. Now the situation is different. We feel isolated. Our people feel isolated from each other. In what ways can people actually keep their sanity in this time? So because this actually leads to depression. So we want to know, how can our people keep our sanity when this major part of our life is almost taken away from us?
I think that's another brilliant question. That's awesome.
Thank you.
Again, like I said earlier, the pandemic seems to have affected everyone in such a dramatic and a very rapid, fashion. So I think the key is that we have to reset the way we have lived. We need to and then, adjustment for you may be different. Adjustment for each one of us is different, But at the end of the day, we have to reset the new norm. We live in a new norm now, right? So I think that, first of all, what I would say is that it is important that each and every one of us, focus on what is within their control, what is within your control. Because what is not within your control, you can't change.
You can change.
Your control is what you can change. And I would ask people to follow the recommendations of the medical community. It is important that we wear our masks, we wash our hands. I like the adverts that you played earlier. Wash your hands, get hand sanitizer. Put it everywhere so that it is clearly available. Avoid your typical mass gathering, where you're mingling and things like that. Wash your hands constantly. The other thing that is important is be informed.
Be informed. Wow.
Be informed, and when I say be informed, I think we are all flooded with a lot of information about COVID-19. You must be able to decipher which one is important and which one is not. And there are many chaff, I call it, information online, that WhatsApp, all of us belong to some WhatsApp group. We've seen the videos and things like that. And very, very important things we need to really understand. For those of us in Minnesota, if you're in another state, I think you should look out for your health department website. But for those of us in Minnesota Department of Health has fantastic, on COVID-19 and resources and things like that. The CDC is the other one that I would recommend. So when you're scratching it, and they present information, for the layman, it's not technical jargon. Everybody should be able to understand it. And then we got to reset things, set your routines, change routines, because the old life, at least for now, isn't coming. Yeah.
Okay. All right. Thank you so very much, Dr. Sam. Once again, this is African Let's Talk. If you join the conversation and you have any questions for Dr. Sam, you are more than welcome to do so. Today, like I said earlier, we're talking about improving wellness as COVID-19 cases keep rising, especially in the African community. We want to know how we can actually improve our wellness and in situations where the COVID-19 keep rising. So please, if you have any questions whatsoever, you are more than welcome to leave your question in the comment box. And at the right time, we would definitely ask Dr. Sam about your question. Doug, some of our people in our community, unfortunately, have been tested with a virus, and and of course, most of them continue to receive treatment. So in this scenario, what lifestyle changes would you recommend for such people?
Wonderful. Again, I think we have to fall back on what we know already. You want to make sure that if you've tested positive, you're recovering, you're home. We thank God for that. But going forward, what are some of the things that you can do? And this goes for everyone, to be honest. Those who have tested positive alone, everyone, because one thing that we need to do is to make sure our immune system is boosted. When I talk about immune system, I'm talking about the natural defense mechanisms that everyone has, and some of that you can do to boost your immune system. And before I even go into it, I know that we have different things from the different African communities, Sobolo and other things that people are doing and drinking in their homes and things like that. I mean, Sobolo is a drink, so I think if there are any medical benefits, it's just an added bonus. But talking about that, eat healthy, diet and nutrition, make it a habit to eat more nutritious foods. Fruits, veggies, and things like that, and cut down as much as you can. If you can't eliminate it, processed foods and other. We all know the junk food, the high fat and all that stuff. So cut down on some of those things. Make sure you're getting good sleep, restful sleep, good rest. It helps. It does help to boost your immune system. Good sleep time is different for each one. I mean, CDC recommends about 7 hours or so. For some, it may be less. For some, it may be more. The other critical thing that we need to do is that we should not forget about other chronic medical issues. So, before COVID-19, there were other issues, right? There was diabetes, there was high blood pressure, there was cholesterol, there were thyroid issues. There were other things that people lived with, right?
Right.
COVID-19 does not mean that you neglect all those things, because if you don't take time, that will kill you before you contract COVID-19.
Right.
It's important that we stay on top of all that. We stay on top of our medication. Take your blood pressure medication. Take your diabetes medication. Reach out to your primary care provider with questions. The good thing is that in this pandemic, there is telehealth. So even if you don't feel comfortable going in and to be seen by your provider, you can call them on the phone. They will visit with you. There are different video platforms, technology, different apps, Google Duo, and other platforms that are being used to deliver healthcare.
Right.
The same way as we used to. So let us make sure that not only are we thinking about COVID, but we are also thinking about other chronic medical issues.
Very
important that we do that. The other thing is that we must stay active. Be active. Be active. And some of us, we're going to the gym regularly. The gyms are closed now. But you can do something. You can do cardio in your house.
Right.
You can do press-ups. You can do other things. Golfing. And golfing is safe because you can keep your 6 feet distance and play off whilst you are exercising. So try and stay active. The other thing, which probably is more important for us in the African community, stay connected with your friends, stay connected with your family, stay connected with people you know. And it goes both ways. If you have a friend, a brother, a cousin, someone you have not heard of or heard about for the last several months, reach out to them. Yeah, FaceTime. You can sign up for free Zoom. Zoom with me as a pastor. I have visited my church members via Zoom, and
it works.
Rather than staying in your house and being depressed and looking only at the four walls of your house, there are other things that we must take advantage of.
Wow.
But we are Africans and we must look out for each other. That's
for each other. All
yeah.
right. Thank you so very much, Dr. Sam. Once again, this is Africa Let's Talk. Today, we're talking about improving wellness as COVID-19 cases keep rising. And the next thing actually I want us to talk about is stigmatization, because we realize that apart from dealing with the stress of the sickness itself, of the illness itself, the other thing is about stigmatization, where those who have been diagnosed with the virus. So what advice can you offer in situations like that? Even before you come in, I think we have been joined, like I mentioned earlier, a gentleman who was earlier diagnosed with the virus. By God's grace, he has recovered and he's ready to share his story with us. Bernard, how are you?
I'm doing very well, boss. How are you too?
I am doing very well. It's good to have you.
Yeah, good to have you too. Doctor, how are you, doctor?
I am glad. How are you?
I'm doing very well, doctor.
All right. So, Bernard, you have a unique story with regards to COVID-19. And we appreciate your time to be on the program to actually tell the story and, of course, the experience about what really happened. So, when and how did this happen? And how did you even know that you had to go get a test?
Well, I think the way this virus works differently in each person. Looking at the guidelines from the CDC, for me, where I work, you have to even take your temperature before you can get into the building. I wash my hands like every minute, but I still had it. But looking at what happened to me, I never had some of the symptoms, especially I never cough. The first thing that I experienced is I was very cold around 2 p.m. and it lasted for almost 4 to 5 hours. So it was a surprise because I don't get sick. And then when I closed for my day shift job, I went to my overnight and they checked my temp, and it was really funny the way the thermometer was even sounding like quick. So, what is happening here?
Right.
So because of that, my temperature was like 101.8, and per the guidelines from my company, I was not allowed to enter into the building. So they asked me to come home. It was around 10 p.m., so I couldn't call. I called the hospital, but it was closed at that time. So I waited until the following day. Around 9, I called them and they set up an appointment for me to test it. I tested on, I think that was Tuesday, and the following day, Wednesday, I received a call that I tested positive.
Wow.
Yeah, but the good thing is, I said to myself, I don't know, we being the Christians, sometimes we have to, say something to encourage ourselves, say something. It's not like you shouldn't go through, the process, what the CDC is talking about. But at the same time, the faith that I had at that moment, was very strong. I said, well, I know I've tested positive, but there's no way I'm going to die from this kind of virus.
Wow.
It's not going to happen. So, I have to keep myself in my room, but the sad part, to tell the truth, I cried one very day when, all the people that sometimes I can go out way, they can come and visit me. Some of them will just come and knock my door and go back and stay in their car, and whatever they have, they leave at my doorstep. My son came there with her mom, and my son was crying because the distance between me and my son, he was asking me, Daddy, are you okay? Are you feeling better? And looking at my son, he's always with me. We play together, and now it's kind of if I die today,
God forbid.
how my son is going to feel, and it was really tough for me within that time. But as I said, some people experience more difficulties than what I experienced.
Yeah.
I lost my taste of my taste and then my smell as well. And I think it took like 1 week for me to start smelling again. The only thing that I had at that time was I think zinc, vitamin C, and vitamin D. And I was eating a lot of pineapple, a lot of tangerines, and then oranges. That was the only thing I had within that 14 days.
Wow.
There was one night that I had little issue. I was having very like breathing issues, and that was when I ate oil. I'm not a doctor. Doctor is here. Maybe he'll be the one to explain very better. But when I had someone brought food and it contains a lot of oil. And after that, oh my goodness, I nearly called 911. So
wow.
Yes, it was really serious at that night. So the only thing that something told me, why instead of you to sleep on your back, why don't you turn and then sleep on your stomach? So I turned myself and then I slept on my stomach. I think I slept all day, and then when I woke up around like 3 or 4, 5 hours, I was fine. So I think that was the only bad experience I had at that time. But mine was kind of easy because I believe myself and I pray to God that I don't want to die at this time.
No way.
Yeah, so God should intervene. So that's my experience.
Thank you so very much for actually sharing your experience with us, Dr. Sam. We will listen about even the first part where isolation was such a big deal in terms of now you find yourself all alone, and of course society now stigmatization. So that part, what can you say to that? And also some of the interventions, some of the different interventions he decided to actually adopt in the process. If you can have any comment on those, please.
Oh, let me start with probably the different interventions. You have zinc, right? And you have a lot of, I'm sure it's
vitamin C and then vitamin D.
Right. It was born out of some studies that show that vitamin C and zinc, can be helpful. They don't hurt. Eating oranges don't hurt. It's full of vitamin C, so they don't hurt. So that's where I will leave that one. Now let's talk about the stigmatization issue. This stigmatization in our communities is a huge thing. It cuts across different health issues, especially when it comes to mental health and others. But
look, I think your line keeps going in and out. Let me take you off in a moment and bring you back.
Hi everyone, I'm Victory Binker. I'm a 7-year-old opera singer and I'm also an actress. I come from a big family. I have 10 brothers and sisters. I recently learned about this census and how important it is that everyone in your household is counted, including kids. The census tells us about how many people live in the United States and lots of other new.
All right, welcome back to Africa Let's Talk. My name is Collins Kofi Opon. Today we're talking about improving wellness as COVID-19 cases keep rising. And I'll bring Dr. Sam back in, and of course, my good friend Bernard back in as well. So Doc, I'm sure it should be a lot better now. We're talking about the stigmatization part, please.
Right. So, like I said, I think we tend to stigmatize a lot. And I think that's unfortunate. But many times, stigmatization is largely born out of ignorance. When people don't understand things, that's when they look at it differently. COVID-19 is another respiratory infection, right? We have the seasonal flu, we've gone through SARS and other things. I'm not sure why people look at this differently. It's not like you do something bad and then you get COVID-19. So I think that is part of ignorance. I think that we're staying informed it's very, very, very important that we have the information that we need. And when I talk about information, I'm talking about appropriate information. And so, I highly recommend you, and I highly thank Bernard for putting himself out on this platform today. Being a vivid example of somebody who had COVID-19 and recovered from it. And he's telling us a story. So I'm not saying you should go out and play the around and get COVID. But if someone has COVID, it's you don't have to stigmatize that. So COVID, Mr. Beyond, let me put it that way. You are doing a yeoman's job. You are doing something that this community needs to support and encourage on regular basis, so that we can see more of these things, more of Mr. Bernard, more of people with attitudes, even beyond COVID-19. So folks, let us do everything to inform ourselves, and then we know to sit back and examine our own sort of judgmental attitude. It's a very judgmental attitude to stigmatize somebody who is not well. It's not by choice that indeed COVID. So I hope that this will serve as a small token in terms of giving us the information that we need, so that we disabuse our minds of all these things that we have.
Okay. All right. Now I want to bring in Bernard. Indeed. So ever since after the recovery, what are some of the lifestyle changes that you have had to adopt in the process of actually the new you? I mean, in terms of after the recovery.
Well, I think a lot of people think that the moment you have it and then you get recovered, you are okay. You can do whatever you want. Now, they find it so difficult to figure out if that is true or that is false, which is still, ongoing. So the good thing is the people that we were friends, we are still friends, I've been going out with them. And sometimes where I used to work, where I couldn't figure out where I got the virus from, as I said, but I've met a lot of people at work, like more than 6 people that I still work with them. They all had it. And now they also recovered. So it's like, people, all of us went to the same house, and then we all came back alive. So, it's a kind of good, as compared to when people start stigmatizing you. But the one thing I would say is, at first I thought, oh, I've had this virus, so I'm good now. I don't have to wash my hands again. I don't want to, wear masks again. But what I realized that sometimes if you get reinfected or if you get infected again, it's so dangerous. So for now, I would say it's God, who's saving me from this virus. And now I have another chance, to live again, because a lot of people died from this COVID-19. So I'm not going to use my life. I'm not going to play like, oh, because I've had it already, so I'm not going to have it again. I have to still go by the guidelines. The guidelines I have to pass through, so that even if I will not be infected again because I've had it, who knows? Anything can happen. So for my community, I have not been stigmatized by anybody. They all welcome me in the community. I go out with my people. We sit down, we eat together, the same way that I used to be with them. So I think for me, I have not regretted. I have not been stigmatized by any way. I would say in that way.
All right. Thank you so very much for sharing with us. And I'll bring you back in. And I'm happy to know that your people have been very cooperative about the whole situation. Dr. Sam, now I want us to shift attention a bit to the burden of what is going on with the virus. I mean, now there's limited income. People are losing their jobs, and the consequences on their health. And now we want to know what would be a good balance so their health is not duly impacted, especially when people have had to deal with all these depression coming from loss of job, loss of income, and all of these things.
So I think that alluded to some of these things, earlier
Mhm.
on in terms of taking care of your health, exercising, dieting, and I also mentioned reaching out to other people, reaching out to other, and then this is probably beyond the scope of this thing, but I would say that we should make sure our expenditure matches our income.
Our
We live
expenditure
in
matches
very,
our income.
yeah, we live in very difficult,
Mhm.
most people, well, I won't say most. I
Mhm.
mean, that would be wrong. That some people have lived paycheck to paycheck. There's no provision for times like these. I mean, it should actually open our eyes to the
Mhm.
realities that tomorrow is not for everyone. Tomorrow we don't know what's going to happen. If
Mhm.
anybody predicted in the beginning of 2020 that we will be where we are now, I'm not sure
No
many
way.
people have believed them. So take care of yourself. Make sure you are still interconnected with everyone else, and make sure your finances just this is not a time to go on a binge shopping spree.
Yeah.
I think everyone has enough clothes at home for now, because like I said, I'm not sure we know the full impact
Mhm.
of COVID-19 yet. Everything is playing in our eyes. Everything is evolving, and
Yeah.
so what is true today may not be true tomorrow. So
All right.
yeah.
Thank you so very much. Mr. Albert comes in and says, powerful. Thanks so much, Mr. Albert, for sharing your comments with us. Now, Doc, there's another thing that just actually came to my mind. I mean, talk of the aged in our community, especially in the African community. For me, the big concern is that there's a situation where we live with the aged, and what guidelines can you offer people who live with the aged in times like this, as to be how well they can be protected, and also how to deal with the needs of the aged in our community?
Okay, I think that we all know, if the one thing is clear about COVID-19, we know that it is that the aged, typically 65 and above, are probably at the highest risk in terms of mortality. When you look at the deaths in Minnesota, you can tell majority of them are people who live in congregate living setting, meaning nursing homes and assisted living facilities and things like that. So if you have an aged person at home, you must go the extra mile. Make sure you clean regularly, wash regularly. Don't stay connected. It's okay to come to the house.
Yeah.
Right. And I believe that if you are listening to me, you should not also be offended when somebody says, well, my mother is 85 years old, I can't be to the house. We must be each other's keeper and not be offended by, oh, I wanted to go and visit him or her and they said that I couldn't come, right? This is not a time to go. So I think that we must rethink the way we have lived and rethink the way we are living now, because if you have an agent, you should do even more to protect. Wash your hands, wear your mask, avoid going to large gatherings and things like that. Because if you bring anything home, you may survive it. Your agent may not, and that would be kind of bad. So let's do all that we can to protect each other. Let's do all that.
Each other.
Everyone on the other side when this pandemic is gone.
Awesome. Thanks so much, Dr. Sam. Now, I want to bring you back in. Bernard, we are about to end the show, but before we do so, we want to know, what advice do you have for people who might have contracted the virus, or, of course, people in general, maybe something that worked for you, if you want to share with us before I let you go.
Okay, so the advice that I would give to people is, no one will just walk all the way and say, okay, I want to be infected with this virus. It happens unexpectedly, and we have to share love to the people who have it, and then who have also recovered, because if you have it and you come out of it, and the people that you think they were your friends or they are your friends are still giving you an attitude, stigmatizing you, it makes it so hard for you to, to live in a community like this. And as Doctor said, at time like this, we have to show courage, love and affection to each other. And then if we can help, especially when we know that someone have it. For me, I was in the house all alone. Those my friends that I told that I knew that, they will be of help. Sometimes some people will go and buy me pineapple, some will bring oranges, some will cook food for me. And it made me feel like, I've not been left alone. I'm part of the community. My people love me. So let's continue on share the love that we'll be sharing for people, who have it and who have even come out. So let's embrace them to the community. And then I think it will help others, to improve. Because I think the one thing I forgot to say is if you start panicking when you have the virus, maybe doctor can say more about this, but I think it's very dangerous because the moment you start stressing yourself, oh, am I going to die? And most of the time I decided not to even go to internet and start checking how many people are dying in a day because it's very dangerous. So I said, let me fight my own fight, and if I come out with this one, it will be a testimony. So let's stay out of trying to search for how many people are dying a day when you have COVID-19, because it can lead you into something else. Because the moment you start panicking, I think doctor will say it's stress, and when you start having those kind of stress, I think your immune system also weakens as well, and it's not going to be good on your side. So
wow, thank you so very much, Bernard, for sharing your experience with us, and we truly appreciate your time, and we thank you so much for doing so. Please.
Okay, thank you very much for having me today. I really appreciate it too.
You're welcome. All right, Doctor. Before I let you go, what advice do you have for us? We want to continue to improve our awareness.
Bernard and his experience, sharing his experiences as a testament to what he's gone through, and his friends who didn't abandon him. I think we should learn from that, and like I said earlier, be each other's keeper. So the bottom line is that I think we must all stay informed, keep healthy, the things that would improve our health. Stress about he's right. Stress can decrease your immune system, and more viral infections. Your immune system is the first line of defense, and the medications that are around you. Everyone knows about the controversy, and that's why I want to stay away from. Is this or is this that or is this that? So do what you can within your control to take care of this COVID-19. Doing everything that we've talked about and the recommendation from the experts, and then obviously tune in next time. We have such a wonderful program here on this Let's Talk program, because I'm loving it. I'm digging it. Thank you very much.
Thank you so very much, Dr. Sam, for your time. And of course, we appreciate the resource that you continue to provide our community, even whilst we are in the process of actually dealing with this whole pandemic, the COVID-19. So is there any predictions, any safe predictions of probably what we should look out for till the end of the year, or maybe up to next year? What are some of the predictions?
Yeah, my bet is on the vaccine.
Oh, okay.
First quarter of next year. God willing, yes.
God willing.
That's my bet. Yeah, we'll live to see.
Until then,
let's keep wearing the masks, and let's wash our hands and use the hand sanitizers. Eat healthy.
The hand sanitizers.
Eat well and all that stuff. And I know I'll see you on the other side. Definitely.
We'll definitely see you on the other side. Thanks so much for your time. We truly appreciate your time today.
You're welcome. You're welcome, sir.
All right. Kennedy says, Bernard, I think this situation exposes who your true friends are. Indeed. I mean, that's a good point. You get to know who really your true friends are. Once again, thanks to everybody who joined the conversation. We truly believe that you're going to pick up some nuggets from this conversation to actually help yourself to improve your wellness during this period. And if you realize that some people also need some help as to how to navigate this whole process, please, you are more than you'll be of good help to them to help them navigate this whole process of the pandemic and whilst we are dealing with it, especially in the African community. A couple of announcements here. For the healing circles, and Pumulani is doing this for community, especially women. So if you are actually somebody who needs to actually have some conversation, you want to be heard, you want to address concerns that are of importance to you, your anxiety and all of that, the first healing circles is coming on Saturday, August 15th. All you have to do is to RSVP by August 10th. This is actually open to women so that you can discuss some of the most important things and have candid conversations and mutual comfort and also find out resources that you need that will be of help to you. All you have to do is to call Comfort on 612-251-9421. Again, another one is that the same Pumulani actually is here to help. I know that in times like this, most people actually have needs for shelter, for financial support, food supplies, and counseling. So if you or any woman you know is facing especially homelessness or urgent supplies around this period, Pumulani is here to help you. All you have to do is to call 612-251-9421, or you can get in touch with African Let's Talk, and we'll be more than happy to provide you with this resource so that anybody who is facing homelessness, or even if it's you, they are able to help give you some shelter in the meantime so that you can actually protect your dignity. Also, please remember that Jordana Online Tutorials is actually here to solve a big problem in our community, which has to do with distance learning in mathematics and science. So please, it's for K-12 math and science. Around this period, if you have a child, especially who has some need in math and science, or want to actually be better in this subject, all you have to do is to enroll today. Sign up today. You can, as I'm talking to you, can go online, www.myjordana.com, and you'll be able to sign up your children K-12 math and science so that they will get the best tutors from around the United States to teach them mathematics and science at the comfort of their home. Why Jordana? Because they have the pool of the best students. It's a flexible scheduling. You schedule at your own pace. You select your subject and topics. So if you realize that maybe you have problem with algebra, you have problem with geometry, and you just select these areas, and they will have teachers available to actually teach you. And they also offer pay as you go. So you don't pay for a package, you only pay for the ones that you need. Thanks, everybody. And of course, we also want to talk about Obasima Catering Services or C's Kitchen. Around this time, one of the things we need is good food. To actually get good food to eat and to survive, you need Obasima Catering Services or C's Kitchen. You can actually call them for your single or your party size orders. So it doesn't matter if it's single order or party size orders, you are more than welcome to do so today. You can call them on 763-221-5621 or 763-614-0438. They have all kinds of meal for your satisfaction. And on this Friday, actually tomorrow, which is August 7th, a big event is coming up, and it's called the Debt Free Series, Managing Your Money God's Way. So if you have found yourself in situations where you have found yourself indebted or in debt, you want to listen to this series by Reverend Mark Jumo of Kodesh, Minneapolis, whilst we treat the debt-free series and how to manage your money God's way. I mean, indeed, there is a way out of the indebtedness. And if you have found yourself in debt, like I said, there is a way out, and you only need to know the right guidelines and the process that you can do this. And it's happening tomorrow, Friday, August 7, 2020 at 7 p.m. You can watch it live on the Kodesh Minneapolis Facebook. Once again, thanks to everybody who joined the conversation. My name is Collins Kofi Opo. You can call me Mr. Beyond. If you have any business you want us to also promote the business, you are more than welcome to actually give us a call on 952-288-6574. I'll be here to promote your business and tell people about what you do. Until we meet again next week with another exciting edition of Africa Let's Talk. Have a safe evening. And remember, like Dr. Sam said, please, until we have the vaccine, and we are very sure about that, please, let's continue to protect ourselves. Keep wearing the mask. Keep washing your hands. And please maintain very decent distance from people that you associate with. My name once again is Collins Kofi Opon. This has been the Improving Wellness as COVID-19 cases keep rising. And we've done this actually in partnership with the Hennepin County. And our resource person was Dr. Sam Asante Boabi. If you missed the conversation, you can always go back and watch this. And this broadcast was actually supported by the Hennepin County's Community Health Improvement Partnership. Have a good evening.
Jesus yalla me wade me de mandali da baby to
No matter where you live or who you are, each of us can help break the chains of COVID-19 transmission. Here's what you can do to protect yourself and others. Cover your cough and sneeze. Clean your hands frequently and thoroughly, especially before and after putting on a mask and going outside or coming home. Avoid crowded places and mass gatherings. Avoid touching surfaces in public as they might be contaminated by someone with the virus. Socialize at a distance. Stay at least 1 meter away from others as much as you can and wear a mask if you can't. If you feel even slightly unwell, stay home. Call your local health authorities and get tested. If you test positive, follow the recommendations from health authorities about how and where you should isolate from others and receive medical care if needed. Make a list of people you have recently been in contact with. Self-quarantine for 14 days if you have been in contact with anyone confirmed with COVID-19. Make sure you follow your local guidance. Each country or area has its own levels of transmission, resources and recommendations, and the situation can change rapidly. The COVID-19 pandemic has changed the way we live, work and connect with others. It is challenging, but together we can break the chains of COVID-19 transmission.